Doctors this morning are warning there is a more severe strain of an upper respiratory virus hospitalizing kids this year. KCTV5 Savannah Rudisell is looking into what makes RSV so dangerous. Savannah, can you tell us if a child has RSV or just a common cold? What are the warning signs for each?
Joe, those two can be very difficult to distinguish, and that's why there have been so many hospitalizations this year for RSV. Doctors here at the University of Kansas Hospital said they have seen a significant number of patients this year, and in certain cities around the country, their cases have almost doubled since last year. So RSV stands for respiratory syncytial virus, and it will mostly affect babies and small children. It can kind of look like a cough, typically a little bit more of a wetter cough, and these kids can have a really hard time breathing. Other symptoms might include some fatigue or just a general disinterest in eating. Well, actually, a lot of RSV cases don't need medical treatment. If it hits those kids and the smaller kids and the babies, it's at least worth a call to your doctor.
But this year, there seems to have definitely been a little bit of a change in the virus just here locally. It's a little bit more severe, and kids having a little bit longer hospital stays, and have seen quite a few young ones who've ended up even on a ventilator for a few days, and then they're still on some oxygen for a few days after and end up going home.
We talked to a mom who had both of her kids had to be taken to the hospital. We'll tell you what she wished she would have known before they got sick. That's coming up at 6:15. Reporting live at the University of Kansas Hospital, Savannah Rudisell, KCTV5 News.
Yeah, it's a scary sickness for a lot of families that have little kids. Any word from those doctors you talked with about how exactly you can prevent it? Is it preventable?
It is, Joe. They say you got to make sure that you wash your hands and you're always very, very careful around babies. I know we just got through the holiday season where a lot of relatives were meeting their newest family members, so that can be a big time for a rise in these cases. So just as with the spread of any germs, you got to be very, very careful around the youngest people and elderly people as well who have lower immune systems.
Okay, wash those hands. The more you do it, the better. Thank you, Savannah. It's